Hi everyone, this is just a little explanatory video on one of the readings we were doing this week, titled A Comparison of Archaeological and Dental Evidence to Determine Diet at a Pre-dynastic Egyptian Site. And you can see all the bibliographic information up at the top. And obviously dental means teeth, so this article is really about teeth. Now I've talked to you about this before. The way that you really should start reading these articles is to look at the abstract first, then the introduction, and then go to the conclusion, and then start over again. So that's what I'm going to do here. So the abstract, luckily, is at the top of this paper. It talks about what the entire paper is about. So it explores the relationship between dietary evidence and that of dentitions or dental or teeth work on a sample of working class Egyptians in the pre-dynastic period from Hierakonpolis in Upper Egypt. So that's what the article is going to be about. And then you can see in a quick summary, the data suggests that they were making bread, there's presence of domestic animals, there's hunting and fishing, and they eat a number of fruits and vegetables. So this is really interesting when you can look at teeth and figure out what people are wearing, or not what they're wearing, what they're eating. And then it goes on to talk about the various things they found on the teeth, like carious lesions, which are cavities, macrowear, like large scratches, microwear, small scratches, and then issues that happen with your enamel, which is the coating on your teeth. And then it says, based on this, we know these people who are living in this area relied on bread and it should be in raw vegetables, but consumed some meat and or fish. Okay, in terms of the introduction, they give a little introduction on pre-dynastic Egypt, which is always interesting to read, and then some of the sources that they'll be working off from. So it talks about where Hierakonpolis is, and then we've looked at this particular cemetery before, HK43, pre-dynastic working class cemetery. And if you remember, we looked at a body in a basket from the cemetery before. Then it talks about what we know about plants during this particular time, and it goes through, in fact, some of the evidence that we looked at before from burial 333. So these are all related. Talks about the presence of cattle, talks about beer, which is pretty interesting. We know that later on, beer is something that almost everyone drank because it was safer to drink than the water, because the alcohol will kill off bacteria and so on. Okay, so we'll skip the material and methods, and then we'll go down to the conclusion. So they looked at 196 individuals, the teeth, and then they talk about the date, and then they talk about what they found. So what they found is that dental caries or cavities, the presence of that was low. And when you read the article, you discover that a lot of times when people eat meat, that changes the pH of their saliva and it reduces the amount of cavities you can have. It talked about lesions or issues that were occlusal, which is where your teeth meet. And then talks about how many people had this. It talks about macrowear, large scratches, shown throughout the life of males, and when we're a bit heavier than the females. So this could show the dietary differences between men and women. And then it talks about how, again, which you saw in the abstract and introduction, people are eating bread, meat, and vegetables in this particular village, which can tell us a little bit probably about what's going on in other places. Okay, so you go back, read the abstract again, read the introduction, and then you can go to the results. Now I've made myself some little notes here. Carious lesions, that just means tooth decay. And they talk about how many people had tooth decay. And I just mentioned there's not a lot of cavities shown in these people, which is interesting. And then it talks about hypoplastic enamel defects, things that are happening on the enamel of your teeth. And that gives you a scientific table of the people who were looked at in this particular village. So you've got males, N is the number. So there's 55 males looked at. So And then it gives the age breakdown. So 18 to 35, there were 39 males. And then almost 49% had hypoplastic defects, so issues with their teeth. And then ages 35 to 50, there were 13 individuals, 38.5%. And then you've got the females on the other side. So there were 71 females looked at, 45%, about 45% had hypoplastic defects. So now you can compare the men and the women, and they talk about the differences in this article. Macro wear, it's large wearing on the teeth, usually large scratches sometimes. Males had higher scores than females, and then they do the same thing. They look at the scientific data with ages, the number of males and females, and what's going on there. Micro wear, so micro means small, so small wear on teeth. And then they show a little bit, they show a photograph here of the differences, and then they talk about the results, where males had a greater range of pit depths than females. And they talk about why this is the case. And then the discussion will do the same. They'll go over their results. So they talk about the cavities and where they were and what this means. So it usually indicates consumption of refined carbohydrates. That's usually bread that gets stuck in the grooves of the teeth. However, it does talk about where the number of teeth that don't have cavities could be related to the amount of meat in the diet, which is interesting. And here I've highlighted this: protein consumption alters the pH of saliva, making the oral environment unfavorable for bacterial growth, which means fewer cavities. And then they go on to talk about the rate of wear and what that means in terms of eating meat and raw vegetables, and so on. And then they go in and they talk about other research too, so gut content. So when they find these people, they can look in the stomach and see what they last ate. Emmer wheat is a type of wheat you find all over the Near East. And then you find small mineral fragments and a high degree of chaff. So what that means is that when they're looking at bread, there are minerals in the bread, and I talked about this in the lecture, where they could break off when the wheat is being ground up, and then you end up chewing a piece of bread and then scraping your teeth or getting scratches on your teeth or breaking your teeth in some cases. And I talked about in the lecture how it could be the stone grinding implements that end up doing that. And then they give a summary of what they ended up finding for the macro and micro wear. And then it talks about the diet. Juveniles may have had more vegetables and less bread, and they're guessing this because of the marks that are found on the teeth, and so on. So, and then you go to the conclusion, which I already talked about. Again, if you're interested in this topic or dietary issues in the pre-dynastic period, please look at the references at the end. You'll find a ton of scientific material, journal articles, books that relate to this particular topic.